Hi, besties. Welcome back to another brand new episode, another new week. How was your Easter? Um, Today's episode features Dr. Marina Kaski, all the way from New York City. Yes. Anyway, I met Dr. Marina in 2023 for the when I attended my second HIV Cure Academy, and we did record a video. It is in my gallery. I apologize for not posting it, even though you did not know about it up until I said it. Anyway, so Dr. Marina today is also going to share with us today how works around the HIV cure, what she thinks a HIV cure would look like in a perfect world, and everything in between.
Hi everyone, my name is Marina Kasky. I'm a infectious diseases doctor in New York. So one way that we try to enhance our ability to bring women with HIV to the clinical trials is to partner with Albert Einstein, which is a hospital in the Bronx in New York, where they're part of the WISE cohort, which is a cohort of women with HIV from longitudinally. So we have been able to bring some women into our clinical trials that way. But I have to say that generally is not, it hasn't been easy for us. And I think in part is, like I said, we don't have a big clinical cohort that we can tap into, but also, challenges with scheduling and other requirements of clinical trials. And I think this is something that is shared with the US sites of the ACTG, which I got to appreciate more when I was the chair of the Cure subgroup. But understanding the importance not only to bring women living with HIV to participate in the study, because they are at least half of the people living with the virus. There are differences between men and women that could be of importance in cure. So understanding this, we have then extended the work that we do to countries in Africa where women are more engaged in. We have followed the guidance that the ACTG has put together, and then there are other groups like Karin Dubé, for example, working with community members. She put together a package of that guides how the study should be conducted. So we follow the best in practice guidelines, where we take the time to discuss the studies and highlight the ins and outs of what it is to come off of ART, the need to continue very open communication with the study site, the nurses and physicians, the need for very close monitoring of viral loads. But really, I think the openness to try to build a relationship where there is an openness of the participant to feel comfortable to discuss, if there are concerns, sharing with partners of the person has multiple partners, how to navigate all of that. So I think we have followed the community guideline, community scientific and community, of how to conduct the study, but in practice really building strong relationships with the partners so we can have an open dialogue throughout the process, which can be very long depending on the study that someone is taking part in. We needed to understand from the community what would be desirable as a cure. When we have been using the term cure, which at the moment doesn't really mean getting rid of the virus once and for all. That has been achieved in a few people, less than 10 people, maybe I think the number now is 7 or 8, in a way that it's not scalable. From the interventions that we are working on at the moment, cure does not equal getting rid of the virus once and for all. of course, ultimately, one would want to achieve that.
Yeah.
But achieving that has only been successful in less than 10 people.
Yeah.
Through, very, through bone marrow transplant and treatments that wouldn't be applicable on large scale.
Yeah.
So what we are talking now is to be able to control, suppress the virus without treatment, meaning that the body, the interaction between the virus and the person's own body or immune system would shift in a way that the body can suppress, keep the virus quiet and not cause disease. So that's the cure, the control that we are talking about. And then I also think that it's important to, now that long-acting ARVs are available and hopefully will become available in wider parts of the world in a sustainable way, I think it becomes really important to understand what would be the advantage of not needing to take any treatment at all versus taking treatment only every 2 months or maybe soon every 6 months. Is it sufficient to take a medication, not think about it for 2 months, or is it really the desire to not think about it at all and then feel that it's done part of the quest? So that is one aspect, to understand, to come to an agreement of what is it that we are aiming to achieve together, the scientists and the participants and patients. In addition to that comes, I think we also have to understand what will be acceptable in terms of interventions. ARVs now, the side effects have become very minimum for most people. When we are thinking about different cure approaches, we also have to take into account the safety. Some of these treatments that are being considered may involve side effects that may not be tolerable or desirable to many people, so that is part of the discussion. And we still don't have a test that tells us, you did this clinical trial, we tested intervention A, B, C, D, and now we look at your blood test and then we see that you're going to do well even when you come off of ART. We don't have that test. Ideally, we will have that test one day so that we can discontinue ART with more confidence that the viral load is not going to come back. But because we are not there yet, then a lot of the studies involve a period where the person discontinues their ARVs. And then when you come off of ARV, you can no longer assume that you're going to be undetectable. So the concept of U equals U, undetectable equals untransmissible, is no longer there, or it may be there, but we don't know when that can change. So that then triggers a lot of, there is emotional conflict, and in my experience, people experience this in different ways. For some individuals, coming off of ART is a relief without the reminder of HIV every day. For other people, it comes with a lot of anxiety because you don't know where you stand in terms of your undetectable status. So this is a very personal experience that I feel that many people don't even anticipate how they're going to feel once they come off of ART, particularly if you've been on ART every day, seeing your viral load be undetectable for decades, and then all of a sudden you don't have that safety net. So these are things that we need to understand, and we need to walk through every step of the way with the participant. And then comes the time of the viral load rebound. Once the viral load starts to increase, because the expectation is eventually the viral load will, with what we have now, this viral load will in most people increase. But for some of the approaches, we need the virus to return for a period of time to kick the body gear, for the body to start to work and then to shut it down. That experience of the virus returning, the viral load going up, is also not a simple one. It comes with a lot of anxiety. So, what the social behavior science research that has already happened, it told us that people experience these periods of the ATI, the contemplation coming off ART without a viral load to the viral load period very differently. And the importance of creating support systems within the clinical trial sites, even with counselors that can guide one through. Uh, but I also think an important piece is now we have more and more reassurance that for everyone that go off ART, even if the viral load goes up and goes up to a high number, when ART is resumed, the ART is suppressed. So to conclude, I think we've learned that people experience differently. It's important to support them through it, but also we cannot make assumptions that a certain community, a certain population will react in the same way that the other one. So that's why it's important to conduct this type of assessment of expectations and experiences in different settings, so we can get a more global perspective of what it is to be part of a cure study.
Okay.
Me personally, I have taken every opportunity that I can to participate in community events and having community conversations. A couple of years ago, I went I was part of the Cure Academy in Zambia, and that's where we met the first time. A couple of weeks ago, we did a Cure Academy in the U.S., and that was the first time that we did that same type of exercise here. And I think I always learn something new in terms of fears, anticipations, expectations with these interactions. So that's what I have personally tried to do, to hear from people that we are working with and working for. What is it that a cure should look like?
And with that, I want to ask you, in an ideal world, what will the cure look like for you?
I would like to that we are able to come up with a regimen, and I cannot tell you if it's going to be one thing, two things, three things, that will have a good enough safety profile, meaning that it's not going to cause someone to feel very ill, that would work for most people. And would be able to maintain that viral load low enough. I don't know if it needs to be less than 20, but low enough so that we are not in a zone where there could be the risk of transmission or concerns for the person's own health. But together with that, I would also like to see ways that we can monitor participants safely, because we can't assume that even if we reach that status of post-treatment controller or post-intervention controller, which is keeping the viral load down on your own, we don't know if that's going to be forever. So I think I want to see a cure that is well tolerated, that leads to virus suppression or low level viral load for an extended period of time, and that is paired with a way that we can monitor the participant for their own emotional well-being, of knowing where they stand, so that the participants, the patients, the individuals can know where they stand in terms of their own health, emotionally and physically, so that we can parallel those. And ideally in a way that it can be scalable to everyone that would desire to participate in this.
Okay, thank you so much.
Subscribe, comment, and like, guys. Like, okay? And I will see you on the next episode with another amazing HIV cure researcher. Bye.